Welcome back to another episode of Bite Back. Teeth, that's the easy part. Being a woman in dentistry, now that's a whole different story.
On today's episode of Bite Back, we've got Dr Anna Nguyen, one of our amazing cosmetic dentists. Welcome, Anna. Thank you so much for coming on the podcast.
Thank you. Thank you for having me.
So Anna and I graduated from the same uni, and I remember you're a couple years ahead of me. I remember thinking, like, you're one of the biggest reasons why I wanted to join DB.
Oh my gosh.
Like, she's like, I'm like girl fanning. I was like, when I first met you, I was like, oh my God. Like, so, you know, you're amazing at cosmetic dentistry and now you've gone into the surgical side of things.
Yes.
Which is like kudos. Honestly, it's I find it a difficult space to enter into, especially being a female.
Yes. So I would probably say, because I entered surgical in probably 2022, and I would say that surgery is a very male-dominated area of dentistry. So if you look at general dentists, probably over 50% of dentists nowadays are female, which is great. But if you go into surgery, I think I remember I was at a surgical conference or something like that, and out of 100 people, there were only 2 females.
No
so
way.
Super male-dominated field, which is fine, but yeah.
We're making our marks. That's the most important part.
And was it the two of you just in the room?
Yeah, it really was. Yeah. So I really think that surgery is still very dominated by males, which is fine as well. But it is a bit daunting to enter into it as a female, especially that it's this procedure that does require some, I would probably say, some risk-taking, being comfortable with, procedures that are a lot more technically demanding and challenging and difficult as well.
I would say for female bodies, it's a lot harder on the female body. Like, let's be real, you know, men and women are built differently. I would say surgery is a lot harder. Do you find that?
I completely agree. Like, I think all the cosmetic stuff, it's not very physically demanding. So it's
mentally demanding, but not as physical.
Yes. But, you know, you're just using fine motor skills. So it's not very difficult. But surgery, you actually need strength. That's what I've realized doing more and more surgery these days. Like, I had a surgery on Monday and, you know, whilst we were doing it, I was actually struggling because my arm is, you know, not very big. And I got everything done, but, you know, compared to, say, the boys who, you know, naturally are stronger than us, I do think having some strength really helps in surgery.
That's one thing that I know for myself I've had to build. I never used to go to the gym. Like, it just was not something I ever did.
Yes.
And then I started seeing my back. My back failed me. Like, it was failing me.
Yeah.
I would, you know, get back pain and aches, and you're on your feet for could be on your feet 6 to 8 hours at a time.
Yeah.
And it was only then where I'm like, I remember I woke up one morning and I was like, oh God, I can't breathe because I hurt my back so much. So I thought, no, I'm not giving up because of this. So going to the gym, it's been my outlet firstly, but also what's helped me get through the career. Like, I've built it up, you've built your strength up. Yep. I went to the osteo the other day and the osteo was like, oh, your right hand is a lot stronger. And I was like, yes, it is. Like, it has to be, you know, and that's something that I think men don't have to think about as much as what us women do.
Oh, absolutely. Like, I think even for me, doing more and more surgery, I actually said to myself, I have to go to the gym and lift because otherwise I'm not going to be strong enough to do what I need to do. Like, for example, extraction of teeth. I think that alone requires a lot of strength, arms, shoulders, back, everything.
I think it's something that has allowed me to get to where I've gotten to is just strength. Purely, like, there's times where I'll take teeth out some of the guys can't. They go, I've just had to work on my strength so much. Oh, yeah. It's at another level.
Yeah.
I actually have a funny story. So I used to do some volunteer work in the Philippines, and we used to have these medical students because it was run by a medical school in Sydney. So there was a dental department and I was like one of the dental tutors. So when the medical students would come around, we'd always give them really easy extractions just so that they got an understanding of what they'd potentially need to do. Let's say if they were in a rural setting and someone came in with a toothache and there was no dentist for like 4 hours, you know. And I remember one guy who was like so tall, he was like 6 foot something. He was like a football player and he was coming up. He's like, yep, I've got this. So when you were talking about technique, you've got to push into the tooth a little bit to widen up the space to allow the tooth to come out, right?
Yeah, that's right. Yeah.
So as I'm explaining this to him, he was like, so how much pressure should I put on this tooth? And I looked up at him and I was like, your whole body. Put all of your weight onto the tooth. And his face was just like he'd seen a ghost. He's like, what do you mean? I put my whole body on it. And I go, yeah, you just kind of lean into it, like just a little bit more leaning. And he was just like completely shocked. So absolutely technique is key, but
technique is key, but if you don't have strength, you can't get it out.
Yes, no, because it doesn't come out the other way.
Yeah, because you need to push hard enough. Like I remember when I was doing, some extractions, and usually I'm very mindful. Like I try not to,
put too much pressure.
It's still like controlled and stuff like that. And I remember, I was watching some of the boys at work when they were doing extractions, and I could see like how much force they were putting, and I was like, I need more strength and more force.
But you've got to be careful too, because I agree. So many boys, like, they break the teeth.
Yeah, you have to be careful of that too.
So it's a fine line, but.
Yeah, there's only I feel like there's a very specific strength that you have to put onto the tooth for it to come out. So if you don't put enough, it's not going to move. But there's that sweet spot where you can actually feel it detach from the periodontal ligament and feel it get mobility. But then beyond that, you end up breaking everything.
Yeah, exactly.
So, yeah.
Anna, what made you pivot? Because you were so, like Amelia said, when we joined DB, you were like the it cosmetic girl. Like, I remember coming and watching you prep and insert, and I was just like in awe. And, I've asked you, like, what technician do you work with? Like, I literally was like, I want to be like Anna. So what made you pivot from doing as much cosmetics as you did into the surgical space?
Good question. So I would probably say I pivoted into surgery because I'd been doing cosmetic for a while, and I was like, I already feel like I know this. I want to challenge myself. I always wanted to have a wide skill set. So not just in cosmetics, but I was like, I should learn how to do surgery as well. And actually my husband was a big reason why I went into that space too, because for a long time I was so swamped in cosmetic work that I didn't really think of upskilling. But then my husband was like, you should learn surgery, you should learn how to do all on implants, you should know how to do more complex stuff. It'll widen the scope of practice that you can do. And yeah, I just thought, it's time for me to expand my knowledge. I've been getting maybe a bit bored of like doing,
it's like a repetitive sort of motion.
Yeah. So it's just like a personal challenge for myself. I just thought, I want to learn more. I want to do more, So then I signed up for some courses and it just went from there. And I would probably say out of all the CPD that I've done, implants is probably my biggest CPD. Yeah.
That's actually so true. We'll talk about CPD on one of the other episodes, and I think a lot of young dentists just think they're going to get out of uni and that just go into it. But courses is probably the biggest, especially I don't know myself, biggest area I've spent money on and invested in, and it's a really important investment.
Especially when the risk is so high, you really need to, need to know how to bail yourself out if something does go wrong. So
operating in surgery, your risk tolerance has to be pretty high to be able to do it. But then of course with that, you need the knowledge and the confidence and the ability to, solve issues as well if they do arise. So I do think CPD is absolutely important and vital, and just really spending the time to understand everything. Like I would probably say out of all the CPD I've done, implants has been the most comprehensive and difficult to wrap your head around because there's just so much out there. Yeah. So many different techniques, so many different approaches.
And everyone's got differing opinions.
Yeah, that's right. And then you have to figure out, what's like going to be most beneficial for the patient, what works in your hands, what technique is good, because other techniques are better than other techniques, right? Like you could probably attest to this. Yeah. Like I remember, the first implant course I took, they were teaching like finish the implant at the level of the crest.
Right. Wow. Crazy. Yeah. But it also goes to show you how far things have come. Like if you look at 5 years ago, they were teaching, like that wasn't, maybe not 5, maybe I should say 10. That wasn't a thing about zero bone loss and taking it deeper. That wasn't really a thing, but now it evolves.
But it just goes to show you have to stay on top of that as well, because if you're not doing the continued education, you wouldn't know that and you'd still be practicing, the old way.
So, yeah, exactly.
Yeah. That's the case with everything, not just surgery. I think it's cosmetic as well. I know
it's like an ongoing thing.
Yeah, my ex-boss that I used to work for, he didn't do FTPs. I don't know if I mentioned this to you. No, FTPs weren't a thing. Right. So it's something that you do, like I think everything in dentistry evolves, and it's massive. Like
Yes.
I think it's a constant learning curve.
Yes.
You never stop learning.
Oh,
No,
yeah.
and you
100%.
shouldn't. Yeah, yeah.
Now I'm 10 years out of uni, which is crazy to think that I am 10 years out. But there's still like a lot to learn.
Yeah.
You know, like
You
I think,
still look so fresh.
Oh, thank you.
You still look 20.
Now that is a good thing, but also a bad thing.
Yeah.
'Cause,
Actually,
like,
tell us about that. Do your patients, like when they walk into the room and they're
Mm.
supposed to, all right, you think surgeon, this big, bulky man, and they walk in and they see you, what kind of reactions do you get?
so I would probably say looking, you know, on the younger side, as well as being a female and, you know, having a little high voice instead of a, you know, like a really like manly authoritative voice. I do think it has an impact as well. And I do think that's a big challenge as well for women in dentistry, because I guess when it comes to surgery, it is more involved. There is more skill that's needed and more training that's needed. So coming off as somebody who does look younger, especially, you know, being a female, you do automatically kind of look younger. It is a challenge, definitely, when consulting with patients the first time, but, you know, I can't really control the way I look.
Yeah.
I think something
Yeah.
that, you know, I completely agree. But
Yes.
what I love to say to patients is I feel like the female touch, especially with surgical patients, they're so nervous. Like they are so nervous. Call me biased. I don't know. I just feel like we're really great at navigating that and just having that emotional connection with patients that do not want to be there.
Yep.
That's the positive feedback I've heard from a lot of patients. But when they first meet you, they go, wait, you? And I'm like, yes, me. And then at the end, they're like, I'm so glad it's been you. But at the beginning, I'm like, oh, well.
Yeah, because it's like what you said, Yel. They expect to see
Mm.
like an older man who's
Yeah.
big and
Yeah.
tall and
And
strong.
old.
Yeah, so it
They
is
expect
like-
someone old.
it, it is like kind of jarring for patients sometimes, where they're like, wait, are you like old enough to be doing what you're doing? Have you had experience in this?
Is this your first time? How many have you
Yeah.
done?
Yeah.
Which is normal. I don't get offended by it at all. It's
Yes.
just, I guess, something that needs to be, you know, we need to make our mark in the community and pivot it a little bit. I think it's just
Yeah.
an older mentality.
Yeah, like I guess that's one of the challenges of
Yeah.
being a woman in surgery, I would probably say. But, you know, like it's like what you said, the female touch. That's I would say that in general, when females operate, we are more gentle than males as well. Like just based off, you know, watching other peers when they do their work and stuff like that. I would say that in general, that's probably true. But yeah, we have our own positives as well.
exactly.
And, you know, we just got to work and navigate our way through it.
Agree.
Yeah.
What advice would you give to the younger generation? I guess this is something we were asking every one of our guests, because everybody's just given it such great advice. So what's something that you...
Or even to your younger self, like
To my
if you were
younger
to
self.
look back. Yeah.
Ooh. Okay, so I would probably say that the mentality of the new graduates these days is kind of different to when we graduated. I would probably say the younger ones are more aware of what procedures are out there and how complex dentistry can be, and they're very keen to learn, which I think is amazing. I think back when we graduated, well, at least in my cohort, like no one really talked about that stuff. We were just like, oh, graduate, start working, do general work. I would probably say to the young ones, it's all right if you just start with simple first, because the simple is your foundation for the complex. But once you want to get into complex and you're actually ready for it, pay for like good courses. Like I'm talking like the $20,000, $30,000 courses. In my experience, have been the best courses. The cheaper ones are okay as well, but I found that the most value and the most I've learned, you know, the more comprehensive, long, more dear courses. I would probably say those will really help you to upskill. The other thing as well is that as you work, you should always critically analyze what you're doing and think about how you can do it better next time. So I use photography a lot in my day-to-day dentistry, even as something as simple as before and after removing calculus, before and after doing fillings. You know, I take photos of everything. And when you take photos of everything, you can use that to communicate with the patient what you've done so they can see the value in the work that you're providing. But not only that, it allows you to actually go, oh, wait, I noticed that. Oh, maybe I could do that better next time. Whereas when you're there and like looking into the tooth through your loops, you might not completely notice. So I think that's probably some of the advice I'd give.
That's great. That's actually really good
Good
advice.
advice.
Yeah. That's the thing, asking this question, like you hear so many different answers and things that like I really wish I had gotten into photography when I first started. I was almost too scared to take the photos because I'm like, no, if it's bad, I don't want to, I don't want to know. It's better to know.
Yeah.
I really think it's better to know, so.
Yeah.
It's also good for record keeping as well.
Oh, yeah. The amount of times that record keeping has helped me, it has been
yeah.
so many. Like sometimes like a patient will come like years later and they're like, oh, this happened. And I'm like, did it? And then I look through all my records and everything is there. So it actually protects you a lot as a practitioner as well. And it keeps the line of communication very open too. Yeah. But I would say like, because I know a lot of clinics have like those intraoral cameras. I don't think they're enough.
They're not as clear. I find them quite blurry and it's just single tooth.
Yeah.
I think you've really got to take the whole arch. It paints a bigger picture, absolutely.
Yeah, 100%. Like I feel like the DSLR, it just captures all the detail and it captures the surrounding.
Well, thank you so much for joining us today and sharing
me.
all of your, I guess, your path through dentistry and, all of your tips and stuff for the younger generation. We really appreciate you stopping in.
No worries. Thanks for having me.
Thank you so much for joining us on our Bite Back podcast today, where we had the lovely Dr. Anna go through her advice and her journey through dentistry. Leave comments below. We'd love to have any questions that you are dying to ask. And if anybody does want to be on our podcast as a guest, please feel free to reach out to us.
And as always, scrubs on, doubts off. We'll see you in the next one.